let me just say first a couple of things. First, I want to thank all of you for coming. I see all kinds of names here. In fact, even some names I don't think I've seen before. This is wonderful. Um, our guest today is Owen Racer. He's the healthcare reporter for the Cascadia Daily News. Um, Recently, I think you just started July 1st. So just a couple of months. It is amazing what he has accomplished in just a couple of months. Um, he's written some really interesting columns about COVID vaccines, staff reductions at Peace Health, price helps hikes in the individual healthcare plans, um, the uh, the WISE pilot program. This is the one that applies to traditional Medicare and uh, additional prior authorizations there. Uh, so today, this is not going to be a presentation, but rather a dialogue. Um, Owen would like to hear from us what's going on from our perspective in Whatcom County regarding healthcare. The things that are happening to us, the things that we hear from our family and friends. Um, and of course, these are, maybe I'll just give the disclaimer right at the beginning too, so everybody doesn't have to start everything they say with, in my opinion. All of this is going to be our own opinion about whatever we think. And while many people here on this Zoom call might agree with some of the opinions, there may be people who don't. And in no way these are the league opinions or league positions. These are personal opinions. Um, and then I think we've got some questions for you, Owen. We'd like to know what you've learned so far. What your impressions of healthcare in Whatcom County is, and there's probably things he's looking into and going to report on that he can't talk about now until he's checked out various, rumors and things like this. So, with that, I am going to turn this over to Owen. Oh, maybe before that, if there will be questions, I know. So if you can either use the raise your hand function in Zoom or put your question in the chat, we'll try to get to it that way. Okay, so with that, I'm going to turn this over to Owen and let him introduce himself and whatever he wants to tell us about himself, and we can start.
Kim, did you have anything to say before I start rambling? Okay. Okay, well, thank you for the lovely introduction. Yeah, as was said, I think the best use of all of our time would be kind of a Q&A format. I also, can't help but ask questions myself, so hopefully I can sneak a couple in amidst your questions. I have, a notepad before me, so I'm going to be writing down things you say as well. But, this isn't going to turn into like reporting. This is like a conversation, not for me to, report a story off of this. I just wanted to make that clear. I'll give a little bit about me, but I really want to keep this local and focused on healthcare locally and not diverge into too much about myself. You'll see behind me that we have a local high school visiting our newsroom today, so don't mind all the folks behind me. Okay, so as was said, I began in July, and I was placed here in Cascadia Daily News, joining a newsroom of about 20 people through a national program called Report for America. And basically, this is a national network that places journalists in newsrooms locally. It was founded in 2017, and it's placed like 700-ish journalists across the country in local newsrooms. It's a project of the Ground Truth Project, and they're a national nonprofit, kind of nonpartisan nonprofit that's kind of dedicated to local news and kind of revitalizing local news that has been on decline in the last couple of decades. And so Cascadia Daily News applied to this program to get someone to come here to cover healthcare specifically. CDN kind of recognized that as a area that people wanted to see more accountability and coverage. And so they applied, and Report for America said, yes, you are a host newsroom that we are going to welcome in. And then Report for America turns around and puts out a call for journalists. And so then I applied. There was about 1,300 people who applied, and 100 people got selected and got placed across the country. And so I was one of those 100 or so. And so I was placed here because of my background in health reporting. Sure, I would have, it's a beautiful place and a great place to live. And it's also happened to be covering the topic, which is, the one that I've been focused on for the last couple of years. So just a brief bit about me. Before this, I was in New York City. I was also doing health reporting there. I, covered healthcare and mental health in particular in New York City and in New Orleans. Before then, I was in New York City getting my master's degree in health reporting. So kind of health is why I was placed here because of the position. And so like, yes, I'm a reporter. Yes, it's nice to be here, but it's also specifically because of the subject matter that was in demand here and my passion and interest in experience doing that. I've reported off topic as well on various other matters that can be brief just for the sake of, this being healthcare focused. But, I've covered politics, I've covered business, I covered sports back in the beginning of my reporting career. So I've done a little bit of everything, international reporting abroad, national politics, all that stuff. Now here, kind of my focus, I think, is a couple of things. I feel like my kind of general view is kind of like three categories that things tend to fall into. And one being public health, which incorporates, I don't know, everything that we all know, social determinants, the health department, kind of localizing national stories, which I've heard a big demand for. I think the second one would be healthcare itself, access to it, affordability of it, transparency of the providers, the people who work in healthcare, covering the providers themselves. And then I think the other third category that I tend to think about when I kind of bracket things off is then just like the people, people receiving healthcare, how we all interact with it and how, people's lived experiences within the two former categories, public health and healthcare themselves, can kind of help us understand it better. So oftentimes that third category I find is either the entry point into a story, someone's experience can often be an entry point into understanding something about either the public health system or the healthcare system itself. Other times it works in the reverse. I identify some large public health topic and then go seek someone who has a lived experience that relates to that. And I think those three categories kind of when you think about like looking at if we had like a Venn diagram or whatever and like where the circles would intersect, that kind of explains why I like doing this, because it's like big systemic issues. Why is healthcare hard to access and unaffordable, and why do we have health issues? But also like the systemic side of like institutions and the bureaucracy of healthcare itself and the public health system. These are all like complex issues that I find frustrating at times, encouraging at times, interesting to dive into, endlessly providing stuff to research and investigate. But then it also intersects with just everyday people, myself included, and you all and everyone we know, and how we intersect with those, as I said, oftentimes big and hairy and confusing and frustrating topics. And so I think that's why, if we think about this Venn diagram, that's why I like doing this. And because it's, intimate, and I tend to be, despite speaking before, many people here, I tend to be a more one-on-one conversation type of person, more intimate conversations. I appreciate having, conversations at length and, in more intimate settings. And that's what healthcare reporting requires to really, I think, to really get to the bottom of stories, is like, intimate conversations with providers and patients and all those things. And why do healthcare reporting locally? I think there's a greater opportunity for transparency and a feedback loop. Like right now, talking to people who read and access local healthcare here, this doesn't always happen. Like in New York, for example, what we're doing right now wasn't really a thing I experienced. In the 2 months that I've been here, I've had more emails come in from local readers than I have in the last couple of years combined. Like people reach out here, people send over helpful ideas and tips. Multiple stories that I've reported in the past couple of weeks have come from people sending me an email about a tip. I feel like the whole nature of like sending a tip to a journalist is kind of this like cliche thing, but it actually does work. And when people email me, it does actually lead to stories. Um, and that isn't always the case when it's not at the local level. But since what we do here at CDN, and just given the size of our community, it's hyper local, and that results in, if I mess up, I hear about it immediately. If I do well, I hear about it immediately. Just this weekend, I ran into someone in Costco who I had talked to for a story a couple weeks ago. And so that is something I really appreciate about doing this locally. That wasn't always the case when I was reporting in Washington, D.C., on Capitol Hill. Like that wasn't the case. And I appreciate how it is here rather than how it was there. I think I want to hear back from you all after I finish here about what I'm going to say here, which is the kind of top things I've heard. I'm new and am aware of the fact that my knowledge is limited locally because I've only been here for a little bit. And so I want to hear from you all what you think the most important things are to cover. But some of the things I've heard include transparency in healthcare, and maybe an absence of it or a lack of it in transparency locally in healthcare. Access to healthcare, I keep hearing come up in all of the different forms that, a lack of access to healthcare can come up, whether it's cost or distance or immigration status, or pick any other sort of thing that may restrict one's access to healthcare. I've heard it come up locally. I've heard a demand for coverage of the local impact of federal changes, national changes, and how the county will be impacted locally by that. And I've also heard a lot about the workforce, the people who work in healthcare, and how their experience, how they are treated, what it's like to work in the local healthcare force. And so those are the couple of the things I've heard that people have expressed to me of, please cover this. And so those are some of the things I'm operating off of, and that list will forever be expanding. But I would hope to hear from you today about what you think should be added to that list or how it should be honed in. Some challenges that come up, I think, are helpful to understand behind the story. Reporting about healthcare is inherently intimate. I'm asking people to tell me about their experience receiving healthcare or not receiving healthcare. I'm asking providers to tell me about their experience delivering healthcare without, violating HIPAA and all sorts of other things. And so I'm constantly asking people to share sad, sensitive, intimate details. And so that inherently comes with challenges. I think this is not unique locally, but just the rise in misinformation in the news, but especially in health and science. It's real, and it takes a bit to sort through. And that is not unique locally, that's just nationally. Trust in the news is down, trust in science is down. And so it takes extra sourcing, extra conversations, and extra digging through resources and studies and stuff like that to just confirm things. And I also think something I've learned locally is there is a lack of transparency institutionally here with when it comes to healthcare. It's not easy to have questions answered always here covering healthcare. People who work in healthcare are fearful to talk to me, understandably, because of consequences that can come speaking to a journalist about healthcare if you don't have many other job opportunities in healthcare. And so that has come up often. People who work in healthcare here, if they leave that job, they have to sign NDAs. And so even people who no longer work oftentimes are hesitant to talk to me. And so that leads to the, in those situations, that's not unique to healthcare. That type of environment is normal in other big institutions and other big systems. And so normally what happens is you go to, the institution itself, and the institution itself becomes a mechanism for delivering information. And that process here has not been the easiest and is often, it's hard to get questions answered. And so these are the challenges that come up and doing local healthcare coverage that I've experienced. I welcome your ideas of navigating that. If you have, you all have lived here and know the systems and people better than I do. I just am fortunate to get paid to ask the questions and do the thing and do the reporting. So if you have tips and advice, I welcome them. But that's been some of the challenges. I know I was kind of, asked to speak about some of the challenges, and that's some of them. I think with those challenges said, some of the goals that I have moving forward in my reporting kind of takes me back to that Venn diagram I explained. Always keeping those kind of three things in mind. Never getting too bogged down in federal stories where I'm, just only doing policy breakdown and I forget to talk about the people who live here, in my neighborhood and are experiencing healthcare. And so I hope to kind of increase transparency through my reporting. I hope to increase engagement in kind of dialogue like we're doing right now. Also, just increase engagement in kind of the healthcare system. I think, I hear not infrequently that the intentional kind of confusion that's happening right now at the federal level and national level around health and science has caused people to just kind of throw their hands up and say, well, forget it. I'm not going to seek care in this domain or this domain because of X, Y, or Z reason. So I hope that the more people reach out to me and the more I report on what people, send me tip wise, the more I can increase engagement in healthcare and in a kind of positive engagement that isn't always the case. And I also just hope to kind of break down confusing, like the Medicare prior authorization thing, breaking down new developments in policy that can kind of help increase understanding at the local level. How things will impact us all here will be a consistent goal. I think I'll stop there with my kind of brief what I'm doing, who I am, and we'll hope to kind of hear from you now. Questions you have. Questions can come in a form of advice or criticism or a question or interesting thoughts you have. But yeah, I would like to open it up.
Owen, this is Kim, and I have a question before we get started on specific topics. I'm wondering if you can help me just better understand the nature of the place where you work and who your editor is, what the editorial constraints are, if any, just kind of how those factors influence your work.
Yeah, what do you mean editorial constraints?
Are you told from a boss what you can and can't cover?
No, no, no. So we have about, let's see, 7 or so reporters, 6 or so editors, and a couple of photographers and visual folks. I would say almost every story that I've written so far has been from a tip that I got, a story that I pitched to an editor and they said yes, or something that was remaining from before I got here that because we're a small operation, there wasn't capacity to handle. And so once I got here, there was a list of things, that people had sent in over time that because there wasn't a health reporter previously, there wasn't the capacity to cover. And so there's very little telling of what to do, and more so reporters are generally trusted as the expert on the subject matter. I'm the one here who is talking to people in healthcare and patients and continuously, so I'm trusted as, if there's anyone here who has their kind of like finger on the pulse of what's happening in healthcare, they generally trust that I know what is the important topic to cover. And so when I pitch something, that's kind of like that's the benefit of having reporters on a beat. I cover healthcare. We have someone who covers education. And so those people are generally trusted as, okay, if they're pitching it, to the editor, meaning I go to an editor and say, you know, I heard X, Y, or Z, and I think this should be a story. I think the default is typically given to the reporter on the beat, and so that's typically how it goes.
You have an elevator.
So, Owen, how would you like to handle these questions? Do you want to watch for the hands in the chat, or do you want me to do that, or what do you think would work for you?
Yeah, you go ahead and call on folks.
Okay. Sherry, I see your hand up.
Excuse me, before we start, could I just remind folks to turn off their microphone until they are speaking or asking a question? Thank you.
I have a concern, and I see somebody else has put it into the chat about an additional hospital. In the history in the city, we always had 2 hospitals until the 80s, and they competed. And so costs were down a little bit, or managed to keep them down a little. But in the 60s, well, when I worked at St. Luke's, which was the community hospital, there was an agreement because everything was getting so expensive back then in healthcare. So St. Joe's became the OB hospital, and St. Luke's the trauma center. And that's the way it was through when I worked there, the 70s. And then St. Joe's has eventually taken over St. Luke's. But I really believe we do need another hospital or some kind of a public hospital district in this area to supply the care. Whether you just can't get into doctors in the hospital. We need more hospital beds that, you know, for other things that maybe Peace Health doesn't want to supply.
Mm-hmm. Yeah, I would say that is something I have heard about a lot. And I would include that when I talked about some of the main things I've heard, and I said access to care. I would say the history of healthcare here, there being 2 hospitals before, and now there being 1, that comes up very frequently, as that's not surprising to all of you, I'm sure. But yeah, I hear about that a lot.
Thank you.
Yeah, related to that, one of the first questions or comments in the chat was, I would like to see articles about the pros and cons of a public hospital district in Whatcom County. And I will save the chat and put any questions or comments. I'll send them on to you, Owen. Sure.
Okay. Yeah, I mean, I'm currently getting ready to do some public hospital district reporting around the election, since 2 of the nearby public hospital districts have elections. Obviously, that doesn't apply to us immediately here, but yeah, it's interesting. It's interesting to look at the hospital districts that are nearby and how people have experienced them.
And then in the chat, I'm going to try to alternate a little bit between the 2 of them. There's a question in the chat about another topic of interest was tick-borne disease in this area. And I have an even larger question about, which is related to this, is environmental climate changes and how that's affecting diseases and healthcare in the area. If you have any comments on that.
No, I don't have comments, primarily because I don't know too much. But if it's a topic of interest, I can.
Yeah,
I am suddenly interested.
I think we had someone talk to us from a group in Seattle, and this was maybe a year and a half ago, talking about some of the changes that were likely to, additional diseases and risks that were likely to occur because of climate change. Yeah, I would agree. I would be interested in reading about that.
Okay.
Yeah.
Okay.
Okay. Ellen, I see. Is that your hand up to ask a question? Go ahead and unmute and ask your question.
Yeah. So I've got 2 questions, or things I'd like to know about. One is the model of Peace Health, which is centralized, what they centralize and how they then modify their plans for each of the hospitals, like in rural areas, there are 2. And it's like part of their lack of communication. They're based in Portland, I believe, where there's a lot of competition. And then once they get into where it's like a monopoly, it's like, how does that impact what some of their policies are? and how they carry out things.
Mhm.
And related to that maybe is, why is there a shortage in this area of some of the specialties? Because people are having to wait so long. The other question I have is, how can a nonprofit contract with for-profit entities like our emergency room, and the hospitalists are both hired by a for-profit agency on the East Coast? And I think a lot of hospitals are doing this. But to me, right there, then people have two bosses, and that's
Mhm.
a real conflict. And we had that show up with our emergency room
Mhm.
during COVID, the first part of COVID, and it became a big case that they lost, the hospital lost. But I don't understand how, and not sure it's very functional to have this kind of system. So those are my questions.
Yeah. Thank you, Ellen.
Would
Yeah.
you want to elaborate a little bit about that, the emergency room? Because Owen wasn't here when that happened. He might, I don't know if he knows the background about that.
What happened was, there was a physician who complained
Yeah.
that they weren't doing some of the proper like entry things, because at the time they didn't know that much about COVID, and he thought they weren't be careful enough about the
Mhm.
way people were being screened before they even entered the hospital, and then what was happening for some of the professionals. And then he got sort of fired, and it was unclear. Actually, he was fired by Peace Health, I believe, but he really then got reassigned, I think, to North Dakota or South Dakota or whatever. And then there was a lawsuit, and he
Mhm.
got back pay or whatever. But it showed the conflict of interest. And also, people still didn't even understand what those hospitalists are doing. They just don't
Mhm.
understand it.
Mhm.
And it's an outside group sort of that is
Yeah.
doing that work. So anyway.
Yeah. 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 Thank you, Ellen. I would say Peace Health is based in right across the river from Portland. They're in Vancouver, Washington. Yeah, and so I that's something I've been trying to gauge in the conversations I've been having with people is how much are people locally interested in more reporting on kind of the business of healthcare and healthcare as an industry, because many of the tips and ideas that I hear could kind of be categorized as like they would fall under the umbrella of the business of healthcare. They come in different shapes and forms and sizes, but a lot of the things I hear are about go back to how hospitals operate as an entity. And so given that CDN as a newsroom is hyper local, we're always, as a newsroom and as a team, when something happens regionally or nationally, we have a conversation about do we cover this? Do people here locally care about this? And if not, or if so, what is the local angle, to localize this? Because I mean, I'm sure we all read multiple sources of news. We get stuff internationally and nationally, and then we go to CDN to read locally. And so we're always thinking about, when is it appropriate to cover something outside of our 2-county area? And so for me on the health beat, one of the things I've been kind of weighing is, okay, I keep hearing all of these, ideas about kind of the business of healthcare. How interested would people be if I started to do some more reporting that may not specifically be locally, but if I started to do some reporting on the business of healthcare and nonprofit hospitals, like I have done previously, then, people might appreciate that, because that is kind of involved in that falls into the bucket of what I keep hearing about locally. And so even if it's reporting not directly about our hospital here, but about kind of healthcare and hospitals as a business in an industry. So all that to say is that what you're saying is I've heard about this. And of course I was familiar with the emergency department employee that you were talking about. I had actually seen that in the news before I moved here. I remember hearing about it because it reached so far. So anyways.
In the chat, someone commented they wanted more information about behavioral health, current staffing needs, how to increase providers. She noted that she hears over and over that folks drive all the way to Seattle to find therapists. And I can testify to that myself when I was working as a psychologist, that I remember a client coming in saying that I was the only child psychologist listed under her insurance in the area. And she was driving, I think maybe about 20 miles to come to see me. This this is the problem.
Yeah, I would love to, hopefully the next time we talk, I can talk about some local behavioral health reporting I've done because before I came here, a really good portion of the reporting I was doing was around behavioral health. So it's an area that I care about a lot. So hopefully I will soon be doing a lot more in that space. So thank you for pointing that out.
Yeah, I know we'd all love to hear it. I see several
Okay.
people on here who were part of a subgroup with behavioral health and are
Okay.
really interested in that topic. So anything you have to say about that would be very interesting.
Okay. Yeah.
Uh,
Well, and I sometimes forget where I read things. I thought it was in CDN, maybe it was another journal, just about the backlog of applications for people in behavioral health, various kinds of licensure under behavioral health. Washington State had a tremendous backlog due to reconfiguring their application system and yeah, I would love to hear a follow-up to see if that's being resolved. You know, here are people waiting in the wings to get their licensure and go to work in the state of Washington, but the backlogs are just huge.
Yeah.
Um,
Yeah, that was not me, but I remember seeing that as well. So you're talking about licensed as a provider. You're talking about,
Yes.
okay,
Yes,
okay, okay.
counselor,
Yeah, yeah.
psychologist,
Okay,
mental, you know, the various mental health fields.
okay, okay.
and then let's see, a question about the reconfiguration of the Whatcom County Health Board.
Mhm.
That is a great interest
Mm-hmm.
to our group.
Mm-hmm.
What goes there. And here's someone agreeing with her. Interested in the number of public comments that the county council and the I believe this is how the PHAB, which I think is the Public Health Board, received about the reconfiguration pro and con. Just general information about what the community feels about that. In fact, do they even know that it's going on? That might also be an interesting question.
Yeah, there's some they're meeting about it again. It's on my calendar somewhere, but
Yeah.
I that's the story that I will be following. And if anything changes about that regarding the Public Health Advisory Board or the Health Board, yeah, I will be reporting on it. That's something I'm following for sure.
Yeah. And then the next one was updates on abortion and MAID, medical aid in dying in Whatcom County. With the Catholic-based hospital system, what are the restrictions, the options? Can these services be accessed? I think we've heard different things at different times, and I'm not really sure I know what the situation is. If I wanted to access MAID, medical aid in dying, could I do it here relatively easily? I'm not really sure. If I wanted an abortion, how easy would it be to accomplish that? Or would it be a lot of obstacles before I could? That might be an interesting.
Okay.
Would like to hear more about that.
Yeah.
Other questions? On my screen, there are two lists of people on my screen, so I'm sometimes not sure that I'm getting all the questions and all the hands that are raised. Is there anyone who has additional questions to ask? Okay. Okay. Oh, Nancy, go ahead. Unmute yourself and ask your question.
Sorry, I'm one-handed today. Some of us are reading a book called Fresh Fruit, Broken Bodies about the health of migrant laborers, and a lot of it's sort of a physician who is a medical anthropologist, and Owen, perhaps you've seen this book, but a lot of the field work was done in Skagit County some years ago. And so, and we actually are going to be, some of us are going to be discussing this book next week. So I was wondering, I mean, I've heard a little bit about from my daughter, who's a nurse in Bellingham, about care for migrants, but I was wondering what you've encountered. Talk about social determinants, I mean, of health. That's sort of I think a focal point, but just what you've heard about efforts to care for migrant worker community.
Yeah. Well, I don't want to speak as if I know a ton because I've only been here so little. So I'll share what little I have heard and seen, but just take that with a grain of salt that it is by no means an capture of the complete picture of what's happening. Because I'm sure my interpretation is that when it comes to caring for the immigrant population, much of the things are happening not just locally but nationally, outside of the especially journalist eye, but out of the public eye, because why would these communities want more attention publicly in the paper and whatnot on them? And so I'm sure my knowledge is limited on this, one, because of that these populations are being taken care of intentionally outside of the public eye and intentionally out of the eye of newspapers. I do know that at home, visits I think have increased, and I think that's something that obviously happened before the kind of general atmosphere became more hostile in the last couple of months. Obviously, at-home visits have been a thing and were a thing and will continue to be a thing. But I think that has increased, and I think that's not just locally, that's everywhere. But aside from that, my knowledge is pretty limited. So it's an area that I know that I need to spend some time reporting on because I've heard about it a lot.
Barbara. Oh, go ahead, unmute. You're muted.
Okay, we're here.
All right.
Okay. My question is related to whether Owen covers or is interested in covering specific programs locally that are designed to assist older adults and minorities in the community. One being dental therapy, and the other one being open caption movies. And the open caption movies is quite recent. In fact, I'm going to see an open caption of the Downton Abbey movie over the weekend, and it only applies to theaters that have over 3 screens. And I think, as a person who has very poor hearing, this is excellent. I love movies. I can't go to a movie where there's accents, for instance, because I can't understand that. So those are the 2 programs that I thought you might be interested in.
Yeah. I think using local programs is a way to communicate and understand broader things. For instance, hearing, or pick your subject matter is always very helpful for me. Is your question, do I cover local programs?
Correct. Also, I need to add that the league lobbied for both issues.
Okay. Yes, I mean, I haven't done too much reporting based on or involving programs locally, but that is definitely something I will be doing, and definitely something that helps. Oftentimes, people who work at X, Y, or Z program are my way into understanding landscapes and such. So yeah, most definitely. Any types of these programs are helpful for me to know about.
In regard to dental therapy, there have been various legislation passed at the state level. And I think it was probably about 2 years ago, they authorized dental therapists in federal health clinics, I think it is, and in tribal clinics. And it might be interesting to follow up on that and see how it's working out, because one of the programs that teaches dental therapy is Skagit Valley Community College.
Hmm.
So it's local, has a local interest to it
Mhm.
also.
Mhm. Okay.
Okay, there's a comment here. Again, thank you for reporting. And I think we'd all like to second that one. And the comment there, interesting to add quarterly reading book lists to somewhere in the newspaper. Like and she mentioned the book she spoke about.
Mhm.
That's Fresh Fruit, Broken Bodies, to open up health dialogues and inform us.
Mhm.
Those questions. Oh, and the question before that was, are you following the Healthcare Commission and the work they're doing to develop a single payer system
Mm.
in Washington State?
The short answer is no, I don't know much. The longer answer is I would add this into the bucket of things that I am quickly trying to familiarize myself with since I moved so recently. So no, I'm not going to pretend I have any inside information or thoughts or knowledge of this, because I don't.
Okay.
But
Well,
noted.
that dovetails with a question/comment I have. Universal health care, Medicare for all, is one of my passions. But it's one of these kind of background underlying issues that doesn't have a huge local presence at the
Mhm.
moment. But, when we talk about access and affordability, all of these vexing problems, it would be such a different scene if we had universal health care. Um, Not that universal health care is just a panacea and perfect from the get-go, but so many of the issues and problems that plague us, I think, would be not almost non-existent. So I'm getting more involved with universal health care through Whole Washington and Healthcare for Us. There are a number of organizations. As I learn more, and if I feel like there's something that you should know, I'll definitely reach out,
Yes.
because yeah, and I think it's just going to get worse as
Mhm.
these Medicaid cuts go into effect,
Mhm.
as more of us are affected by Medicare changes.
Sure.
It's going to get worse.
Yeah. Yeah, I get the sense that what you're saying is going to apply in the sense of things getting worse. I get the sense that, and I'm sure you all are as well, that it's going to be very helpful to have someone every day writing and trying to parse through all of healthcare changes, because I think things are just going to there's going to be a long piling of a list of things changing in the trickle down effect of them. So yeah, I will definitely be paying attention to that. But if I may ask a question about that, because when we talk about universal healthcare, I think most people think about what comes to mind is the politicians who advocate for or against that. And something that I've noticed in my coverage so far is I haven't really talked to many elected officials for my reporting, because most of my stuff has been healthcare focused in the sense of not really involving local policy or politics. Aside from say the health board story, I talked to Councilmember Scanlon for that. But my question would be, would you hope to see, the question for any of you, would you hope to see more elected officials voices and opinions represented in my health reporting? Like, is that something you would like to see more if I'm reporting about I don't know, pick your topic. Would you like me to see push those questions to some of our local elected officials? I see some head shaking.
Well, I would say when appropriate, yes.
Okay.
But like, I don't know that now is the time for local officials to weigh in on universal health.
Yeah, that was just an example. Yeah.
So I'm saying that's a place where, but this Board of Health issue, that is purely a local
Okay.
issue. And yes, I'd like to be hearing from our county council members
Okay.
about their thoughts on the pros and cons of it all.
Okay.
Yeah.
I see a
Oh.
question about what is planned for the old
Yeah.
St. Luke's Hospital building. I don't know, but I have been curious myself, and I have heard from others that they are also curious. So again, I would put this into the question I've been trying to figure out, which is how much do people care about the history of our healthcare providers here? And if the answer is we care about it and we want to learn more about it, then I'm personally interested. And so I'm trying to weigh how much am I just interested in this because I am really interested in nerding out about healthcare and health policy and in all of the sorts, or are people also interested? And so you posing the question, Margaret, makes me think that yes, it is worth. So noted.
And that might be a relatively easy one to cover.
Probably.
It's just like a white elephant ghost that's sitting in the middle of our community. And my husband and I were just talking about it yesterday when we drove past it. What's going on here? So I think a lot of the community would like to know.
I think maybe Nikki was next and then you, Sherry.
Okay.
Not sure about the order of hands here. So Mickey, if you want to unmute and ask your question.
In regards to all the talk about Medicaid cuts and whatnot, I think it might be beneficial for the community to be aware of the fact that if a person is on Apple Health, they're on Medicaid. And most people don't know that. And like in California, it's Medi-Cal, and they don't know they're on Medicaid. And if more people realize that they were on Medicaid, it might change a lot of dynamics, not only politically, but just culturally and health-wise and all that. So maybe you could do a sort of a primer on, did you know that you're on Medicaid? If health? And
yeah, it might be interesting to list at the time I was working, there were 5 insurance companies who were part of Apple Health in this area. Different configurations of insurance companies in different parts of Washington, but here in Whatcom County there were 5. I'm not sure what it is now.
And the other thing I wanted to suggest is, and this would be maybe like a feature, but I have a great deal of respect for what's called the Ask a Nurse program.
Yeah.
And so if you could do something to kind of highlight what they do, that would be great for the community to know more about.
Would you
So-
repeat that, please, Mickey?
Repeat the name of the organization?
Yes.
Ask a Nurse program. It's through
Ask
Health.
a Nurse. Gotcha.
Ask a Nurse program is through Health Ministries Network, and that doesn't mean it's about religion at all. And they do a lot of really outstanding work in some of the underserved areas in our county. And I think if there was a little spotlight feature on them, it could be like a good news story.
We could always use more of those. Wait, can I ask a follow-up question, Mickey, about not knowing about Medicaid and Apple Health? Does that, in your experience, since I'm newer, people not knowing, do you think that crosses 2 things? A, political views and geography. Like, would you say that is kind of, regardless of where you are politically and where you live locally, that is the case?
Oh, yeah, absolutely. I mean, I know of people in, for instance, California. They don't know that they're on Medicaid because they're on Medi-Cal, which is Medicaid. Or in, I think, like Oklahoma, Sooner Health, and that's Medicaid. And so it's really not just here in Whatcom County, it's across.
Yeah, yeah, right, right. Okay. Okay. Thank you.
Sherry, I think you had your hand up next.
Okay, I was just going to mention that about 3 or 4 years ago, Jay Inslee, our governor, put together the Universal Health Care Commission, UHCC, and it has been meeting quarterly or something to try and develop a universal health care for Washington State. It's very slow going, and it's been years, and they still aren't any much further than they were, but they have been investigating. But I wanted you to maybe be aware of that organization.
Okay.
There's something else, but I can't remember what it is. So
We'll come back.
Martha, can you unmute Martha?
Martha or Marty? I'm under Martha. Okay. I've been very concerned about the forthcoming Medicaid cutbacks and specifically on the impacts on caregivers of extremely disabled children and adults. I don't know if their hours going to be cut, and I guess we just have to wait and see how all of that evolves, right? But I think that would be something to follow up on over time. Also, the work requirement, because people who are severely disabled, they don't know, are they going to be included in these work requirements? You know, that may be spelled out already, but the general public really doesn't know. So I and other friends who have gravely disabled children, we don't know what that's going to,
Okay.
how that's going to impact our kids.
Okay. I will thank you for noting that.
And kind of related to the issues of legislators and things. There was a question about the portion of our county's budget that is used for public health, including the public health department programming within the jail and services to the unhoused. So more information, more public information regarding that.
Okay. Yeah, I know some of us over here in the newsroom are working on some budget breakdown things from the county. So yeah, we should have more on that in the coming couple months regarding budgets and stuff. So thank you for noting that.
Yeah. And I had something that might be interesting. 2 or 3 years ago, there was a pilot program where physicians were prescribing food for certain patients. I think that was in conjunction with the food bank. I think it ran for about a year. As I understand, at the time it was successful, but I don't know what's happened. Was it continued? Is something else in place? That could be that could be interesting to find out because certainly access to food and nutritious food is important to health.
And could be increasingly so with changes to food programs.
Yeah.
Yeah. Yeah. Okay.
Yeah. And then also I'm going to add some of my own things that I'm interested in. More kind of follow-up things. Recently, you reported about staff reductions at Peace Health. Really interested in who these people are. Where specifically, I know they were very general, and how that might affect palliative care and hospice care, a program that we're concerned about. It's been cut before. We're concerned whether it'll be cut again. And then I think you also wrote an article about Mount Baker imaging and the hacking that went on there, and any follow-up that you might have on that,
Okay.
what's going on there.
Yeah. Yeah, I will say that I'll take the latter one first. Mount Baker Imaging, Isaac, our investigative and enterprise reporter, has been following that for a while, and he has been doing updates on that story. So that's kind of like for like the health board, for example. Anytime anything happens on that, I will write about it. With Mount Baker Imaging, anytime anything happens with that, he's kind of on that. Regarding the Peace Health employees, this goes back to what I was saying at the beginning regarding the challenges of healthcare. Reporting on healthcare is when is it appropriate to, when we're covering things like, I don't know, court cases or people's employment, it's a newsroom ethical question that we discuss of when and when not to name people, when is it fair to name someone? When is it important? When is it transparent? It goes back to like journalism ethics types of questions. And so regarding Peace Health, obviously I wanted to know what the local impact was. And, when they announced cuts in May, the 1% system-wide across all of their hospitals, this was before my time, but when I went back to read the coverage, the hospital wouldn't say what the local impact was. And we still don't technically know, despite asking. And that was again the case with this most recent layoff. Obviously, I asked these questions, but answers to them weren't necessarily provided. So I will keep trying to figure out what the local impact is. But just because I'm asking doesn't mean the answers will be necessarily provided. But yeah, I'm also interested in what you shared. Yeah.
I think we all appreciate the difficulty of getting answers.
Yeah.
Yeah.
Owen, are you aware that there is a Whatcom County resident who's on the Peace Health Board?
Yeah. I remember someone told me about how it was a push that was put together that there wasn't someone, and then once there was someone appointed, that it was important. Yeah.
Right. And I don't know how able she is to speak up, but Ione Adams was
Right.
a CMAR physician here in Whatcom County and a really stellar human being. And she's now on the Peace Health Board.
Yeah, that would be, go ahead.
Oh, no, I don't want to interrupt you. Finish what you were saying.
I was just gonna say that would be a good example of combining a people human story with healthcare of, get to know X, Y, or Z person. That would be a good example. I think that would, yeah, I would be interested in doing that if they're willing to make her available.
Albert, I saw you put a question in the chat, and I'm not sure quite what you meant. The comment was issues to discuss with local legislators.
Yeah, I just didn't want to type it out, Marilyn. I was just trying to get your attention.
You got it.
Okay, no, it was way back when we were talking about legislators and should that be reported and should they be interviewed. And I guess I'd want to put a plug in to say that maybe they're not doing really systemic changes yet, but in particular, Alicia Rule, I think, has tried with different legislation with workforce increasing, with programs in the schools that hit very low-income kids for food and exercise, for staffing of nurses and social workers in schools. And I know I support her a lot with those things, and so I kind of follow her a lot. But they're not big, major things, I suppose, but they are something that speaks to the population and speaks to the issues. And, I don't know about Sharon Schumacher. I know she's on a bigger level with wanting to tax people who have higher incomes more. And so I think that's a good thing to always put in the newspaper. And then a feel-good story. When I look around my neighborhood and see the WTA picking up my elderly and disabled neighbors so they can get out of the house, go to the store, go see somebody in their house down in,
Mhm.
you know, Alabama Hill or whatever. I think I just want to shout out and say good for them. And I hope
Okay.
that the county supports them with whatever things happen in this next couple months of cuts.
Mhm.
Thanks.
Yeah, thank you.
No, the last comment I see in here, was, it said, yes, please include elected officials' positions. Oh, okay, I wasn't sure what that meant. I think they're talking about, when you're talking to them, when you're talking to a council person or someone, what is their position on this, that, or the other thing?
Okay.
Okay, I think that's what that referred to. Sometimes in a chat, things get out of sequence and it's hard to type.
Yeah, it's okay. You're
was.
doing a good job.
Okay. If I've missed, oh, Mickey, I saw your hand up for a moment. Did you want to say something else?
Yeah, I didn't know if I had my hand up or not, but something it just popped into my head with this most recent discussion. And one of my things, and I know this is, it's not about me, it's about, the whole community, but I am a fervent proponent for getting diabetes prevention and education on the public health agenda.
Mhm.
And a number of us have made attempts at getting the council's attention on that. And because, they are the health board at this point. And we get, 3 steps forward and then like 5 steps back. And so maybe with the new health department director coming in, you could see about doing a story on diabetes prevention and education being focused on as a public health issue, and also getting it into the schools. Now kids are being diagnosed with type 2 diabetes at 10 and 12 years old,
Yeah.
and it used to be that was something that happened with adult onset,
Mhm.
but not anymore. So
Mhm.
anyway, that's just an idea.
Yeah. Yeah, you raise a good point. Would you all like to hear from the new director of the health department once he's here?
Yes, yes, yes.
Yes,
Okay.
I think that's unanimous.
I figured I would like to as well. I will. Yeah, hopefully we can do a get to know you story with him once he gets here.
Okay. I'm wondering if you have any information or knowledge about how the new traditional the WISE program for traditional Medicare was authorized. Previously, changes to Medicare either came through a waiver requested by a state or uh, perhaps the CMS proposed some program and various groups would sign on to it, like Peace Health, sign on to ACO REACH. This, from what I've read so far, it just sounds like I think it's 6 states
Yeah.
it's effective in. Did the states request it, which seems unlikely in Washington, or was it imposed on them? Or...
Yeah, I think what's interesting about this is that, yeah, if you look at the states that are involved, there's like politically, the states are very different. I think the states are, as politically diverse as Ohio, New Jersey, and Washington and Oklahoma, which all have very different politics. My understanding, which is quite limited because information was pretty limited at the time when I wrote about this, since it's just a pilot program. My understanding is that I think it has something to do with populations of the state and the setup of the healthcare of the Medicare delivery in the states, because it's so limited in scope, in the sense of it's only 6 states, as you said. It's also super limited in the sense of procedures that it'll apply to. And I think since it's only surgeries, it only applies then impacts surgeons, is my understanding. And so I don't have a lot of details as far as if states applied, which, as you said, that you don't think they did. I also don't think that states applied, given the quite different political views statewide. This is something that I'm going to be following, since it's going to be a kind of rollout over time, and we'll report on it if I can figure out a way to, find Washington residents impacted. But at the time when I reported the story on it, I couldn't find much information available about kind of why the states were picked, why the certain procedures were picked. I mean, they said these procedures were picked because we think, we as the federal government thinks there's an opportunity to save money by selecting these services. So beyond that, there wasn't that much information. And I think that is kind of with the wiser model. It's they're saying it's all about cutting costs and cutting waste and all of those things. And so other than that, the information was pretty limited when I was looking into it. So I wish I could provide more.
If as these things are rolled out and there's information you would like, I can send out an email to our members asking them to contact you if they've had any experience with a particular program or problem or whatever. And then
definitely, I mean, that applies to everything. I mean, you can, I mean, people are welcome to reach out at any time with personal experiences, things they've heard, etc. I welcome it all.
Yeah. There was one final question, and then I think maybe we need to let you go so you can go do some reporting. This person is wondering whether there are mobile services that go out into rural areas, and if so, whether you've been able to tag along on a run.
I mean, I forget. I think Mickey mentioned Ask a Nurse. Ask a Nurse. Nurses go out into the eastern part of the county. I haven't gone along with them yet. I've talked to one of the nurses. I've talked with one of the nurses who does do this, and I had already been planning on doing a story with them and joining one of them. I haven't yet. I have gone with other nurses out into the county and done ride-alongs. I haven't reported on them. There's a lot of things that I do and have been doing just informationally, so I can get to know people and the area and services and providers. Yes, I've done a lot of stories so far, but I think in a normal time I would be producing more, but I've been intentionally spending a lot of my time just not writing and not reporting because I'm trying to get to know what people care about, know people. And through doing that, I have done a ride along with a nurse who goes out into the more rural parts of the county. This was actually a nurse who goes and visits immigrants in the community. And so I have been doing this. This was not to be written about or to be, directly reported on, but more information on background to help me, down the road when something does happen. I already, have a little bit of insight and know somebody rather than if something happens and then all of a sudden I don't know anyone. So yes, I have been able to tag along. I plan to do more ride-alongs with providers in the county. Yeah.
Go ahead, Kim.
Owen, how long is your assignment with Cascadia Daily News?
That's a good question. So I'm here for 2 years, guaranteed. And I say guaranteed because it's only a funding situation. So, I mean, I'm just a normal employee of the newsroom, just like everyone else. The way the program works is for 2 years, the National Report for America program, which I explained, kind of places me here. They cover part of my salary. And then because CDN was selected to partake in this program, CDN is then required to do fundraising for my position. So you've probably seen us put out fundraiser things for my position. And so I say 2 years because the part of the contract is 2 years guaranteed. And then the third year is optional. If I want to stay here, if CDN wants to keep me here, and then if there's still funding. And so if I want to stay for a third year, which I'm having a great time so far, and I don't anticipate any of that changing. So that would mean the third year, CDN would have to raise a little bit more. So Report for America guarantees 2 years, and then the third year, they'll provide a little bit of funding. But if I and the newsroom agree that I want to stay here and they want to keep a health reporter, CDN then has to cover more of the salary. So right now it's about half, I think. And then the third year, it would have to be about 3/4. And so That's why you see CDN putting out fundraising and announcements, because we still have to fundraise for my role. Even though I'm here staffed and reporting, my role isn't completely, funds still have to be raised for it. So 2 years.
I see Nikki has her hand up again, and this will be the last question. You do get to leave.
Hey, this isn't really a question, but one thing and that I would add to what Owen just said, that, CDN is doing fundraising for this. And even though CDN is theoretically a for-profit organization, they plow everything back into doing their work. They're not looking for making a profit. But if you donate, it's tax deductible. I think that's important for some people to know.
Yeah. Thank you for pointing that out. Yeah.
Okay.
Well,
Thank you.
speaking for myself, it has been such a wonderful addition to our community to have a vibrant, healthy newspaper and reporting team. So thank you so much for being a part of that.
Of course. Yeah, no, this is what we're doing right now goes back to what I was saying at the beginning of why I like doing this, because I get to talk to folks like you and hear from folks like you. So it's a benefit of doing the work, and it's only getting started. I've only met so many, a small number of people. So hopefully I just keep getting to, have more of these conversations, and then hopefully the reporting will reflect that. The more conversations I have, hopefully the better the reporting becomes. So hopefully it's a good just spiral that we all build here. Yeah. So thank you.
Exactly.
Thank you for having me.
Thank you for coming. We very much appreciate this. This will probably be, typically it's up on the Lee website within about a week. And I will copy the chat and send that to you, Owen, so
Great.
you can see the comments.
Great.
So,
I put my email and phone number in the chat, so anyone's welcome to reach out at any time, question or comment or complaint, any form.
yeah, the more information, the better.
Of course.
Okay. Thank you very much.
Alrighty. Goodbye.